On behalf of my colleagues from the ECSA Secretariat, I join our host, Comrade Richard Moyo, in welcoming you to the 67th Health Ministers Conference. May I also, on behalf of all the honorable ministers and all the delegates, Your Excellency, register our deep gratitude to the Republic of Zimbabwe for hosting the 67th Health Ministers Conference at this, one of the natural wonders of the world. In so doing, Your Excellency, Zimbabwe is hosting the conference for the fourth time. The earlier times being in 1985, the year 2004, and the year 2010. It is also symbolic that it is for the second time that Victoria Falls and indeed Elephant Hills is hosting this conference for the second time. And for all that, we are truly grateful to the Republic of Zimbabwe. And on all these four occasions that you have hosted us, the generosity of spirit of the Zimbabwe people has been matched only by the warm hospitality extended to all of us. And I know I speak for all delegates when I state that we cannot wait for the next time the Health Ministers Conference will be hosted by the Republic of Zimbabwe. Your Excellency, the 67th Health Ministers Conference represents a process that has remained uninterrupted since 1972, that was followed by a similar meeting in November 1973 in Gaborone, Botswana, during which Sir Seretse Khama urged the ministers to formalize the arrangement so that they establish a mechanism for for greater cooperation within the region. Thus it was that in 1974, with the generous offer of the United Republic of Tanzania, your secretariat was established in Arusha, Tanzania, with a modest complement of 3 staff. Such were the humble beginnings of the organization that has not only stood the test of time over those 45 years or so, but has remarkably expanded to answer to the original call, which remains relevant today, of fostering regional cooperation in health. Your Excellency, honorable ministers, heads of delegation, distinguished delegates, allow me to share with you all the sense of optimism for better health outcomes for our peoples as we start this conference. It is a sense of optimism born of several initiatives, too numerous to mention, but all of which speak to increasing global commitments to health and well-being. I shall reflect on but a few of them. My sense of optimism is rooted in the Agenda for Sustainable Development, with health and well-being as one of the 17 Sustainable Development Goals as adopted by the UN General Assembly in 2015. It is a sense of optimism whose streak runs from the ambitious AU Agenda 2063, the Africa we want, which envisions healthy and productive populations. It is a sense of optimism that springs from one of the initiatives and indeed legacy projects of the erstwhile Secretary General of the UN, Ban Ki-moon, the UN High-Level Commission on Health, Employment and Economic Growth, that, as Your Excellency and Honorable Ministers will remember, was co-chaired by Presidents Hollande and Zuma, among whose major findings and recommendations were the far-reaching proposals on action for health employment towards achieving gains across the 2030 Agenda for Sustainable Development. The message that comes across clearly through the work of that commission is one for multi-sectoral action to ensure greater investment in health and in health employment. It does include a statement of fact that job creation in health is a major driver not only of investment but of development in general, especially since the health sector by and large employs women in the majority, and we all know that employing women is one of the best buys in the quest for human development. It is estimated that an additional 18 million jobs will need to be created in the health sector, and most of those 18 million jobs will be in the developing world, including our region. To train more health workers, Your Excellency, we need young people. And Africa has an abundance of young people. And therefore, as an African situated in Africa at this point in time, I cannot but be optimistic that we are going to contribute ably to bridging that gap in the 18 million health workers that will be required to drive this agenda. Your Excellency, the enabling resolution, my sense of optimism is not misspelled. It's not misplaced, for in December 2017, the UN General Assembly resolved to convene a high-level meeting on universal health coverage during the 74th session of the Assembly in 2019. And so the issue of universal health coverage, which is what this conference is beginning to interrogate, is going to feature prominently at the highest level of policy. And Your Excellency, Honorable Ministers, will recall that the enabling UN General Assembly resolution for the 2019 Universal Health Coverage High-Level Meeting reminds us all of our commitments under the Sustainable Development Goals Target 3.8 to achieve universal health coverage that must necessarily include financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. In addition, that resolution underscores the need for enhanced international cooperation and assistance to help governments implement universal health coverage, universal health access to health services. This is the stuff that my optimism is made of. At the risk of indulging in overkill, Your Excellency, let me take the liberty to briefly mention the WHO 13th General Program of Work, which is designed to accelerate progress towards the SDGs through the imaginative and ambitious triple billion targets. These are 1 billion more people benefiting from universal health coverage, 1 billion more people protected from health emergencies, and 1 billion more people enjoying better health and well-being. Your Excellency and Honorable Ministers, distinguished guests, will recall that at the last UN General Assembly in September 2018, among the resolutions passed were those reaffirming the political declarations on the urgent global responses to end tuberculosis, and another on accelerating efforts towards addressing non-communicable diseases. And these are both issues that our region grapples with. And one cannot be but optimistic when one notes that increasingly health and investments in health as drivers of human development and shared prosperity have become mainstream in the global diplomacy agenda. Your Excellency, if you needed more justification for the sense of optimism I bring to the 7th Health Ministers Conference this morning, allow me to report that I was privileged to witness our own Honorable Dr. Moyo, your Minister of Health and Child Care, join other global leaders in Astana, Kazakhstan, only a few weeks ago at the 40th anniversary of the Alma Ata Declaration of Primary Health Care. On that occasion, the global community, under the leadership of the World Health Organization and the United Nations Children's Fund, unanimously adopted the Astana Declaration on Primary Health Care, which, among others, enjoins us to make bold political choices for health across all sectors, to build sustainable primary health care and primary health care systems, to empower individuals and communities towards health and healthy lifestyles, and to align stakeholder support to national policies, strategies, and plans. That commitment was informed by the realization that while great strides have been made towards improving health outcomes globally since the Alma Ata Declaration in 1978, there remain many persistent challenges. For instance, less than half of the people in the world today get all the health services they need. In the year 2000, almost 100 people were pushed into extreme poverty because they had to pay for health services out of their own pockets. The menace of the non-communicable diseases is real, with an estimated 13 million people dying of a variety of non-communicable diseases annually, and most of these 13 million that do succumb to the non-communicable diseases are in low and middle income countries, and therefore including our region. It was also clear during the deliberations at Astana that a primary health care approach remained the most effective way to sustainably solve today's health and health systems challenges, and hence the global health community reiterated the primary health care approach as foundational to achieving our shared global goals in universal health coverage and the health-related Sustainable Development Goals. I have no doubt that their standard declaration will inform and influence the discourse at the United Nations General Assembly high-level meeting on universal health coverage in 2019. Your Excellency, as ECSA Health Community, with the guidance of the Advisory Committee, have taken this intoxicating sense of optimism, turned it around, looked at the issues we are dealing with in the region, and for the 6th, 7th Conference of Health Ministers, we have chosen the theme Universal Health Coverage, addressing the health needs of the underserved. Over the next 3 days, Your Excellency, we shall reflect upon the extent to which we have, as member states and partnering organizations, and as your Secretariat, fulfilled or otherwise the commitments made at past conferences. We shall share ideas and exchange experiences and approaches on cervical cancer, which is one of the deadly epidemics within our region. We shall revisit our responses to the vexing question of the health workforce and the extent to which we are responding to labor market forces that threaten the gains we may be making through the various initiatives. We shall explore ways of ensuring equitable setting of priorities towards universal health coverage, given the resource-limited settings in which most of our countries and health systems operate. We shall address the health challenges posed by the increasing trends towards urbanization in our region. And at this point, may I indicate that in the last week of this month, the Republic of Uganda will be hosting the global community at the 15th International Conference on Urban Health. And the resolutions, the findings from here will definitely be fed to the rest of the global community so that we find what traction we can get. Within the next 3 days, we shall simultaneously keep an eye on the ever-present threat posed by antimicrobial resistance. We are aware that for a number of conditions, it's becoming increasingly difficult to find effective medications, and we need to be adept to approaches to ensuring that we avert this crisis to the extent possible. And Your Excellency, we shall at the same time appraise each other of efforts towards fulfilling the adage that nutrition is health, so that we shall have specific sessions that will address issues of nutrition and food security within the next 3 days. Your Excellency, Honorable Ministers, Heads of Delegation, fellow participants, this long address is intended to ensure that I do not create any undue expectations of what lies ahead of us over the next 3 days. We do have a packed program with lots of pertinent issues to grapple with, and I thought I should start the meeting in that kind of spirit. But it is a spirit of optimism, because with everything that is happening, surely Africa is going to move in a different trajectory. And with those remarks, Your Excellency, Honorable Ministers, Heads of Delegation, Fellow participants, I thank you all for your attention.